when you were talking? Okay.
Yeah, we're working on that on our side. Good morning, and thank you for joining us for Intermountain Healthcare's local, diverse, and sustainable supplier event today. We're really excited to be with you this morning. We really want to focus on food and catering suppliers within the communities that we serve today. My name is Shane Hughes, and I am responsible for supplier management for Intermountain Healthcare. We'd really like to give a big thanks to Salt Lake Chamber for their assistance in promoting and developing this event. We'd also like to thank all of you local, diverse, and sustainable suppliers out there that are sharing your time with us this morning during this crisis that you're living every day. We really hope that our content is meaningful and timely this morning with all of you, just because we want to share with you how we want to engage you going forward, and how we really want to change the way we do business to really impact the communities that we serve. If you have any questions throughout the presentation, please use the chat feature within the Zoom meeting, and we will hopefully get to those questions in the remaining 15 minutes of our event today. Thank you for your time, and we will jump right into our first presenter, who is Allison Corey, our Assistant Vice President of Procurement at Intermountain Healthcare. Allison, the time is now yours.
Are you guys able to hear me? Great. Thank you so much. I really appreciate the warm handoff there this morning. Again, my name is Allison Corey. I'm with Intermountain Healthcare, and I am relatively new to the organization, about 10 months here, and I'm the leader over our procurement function. So as we define procurement here at Intermountain Healthcare, that is the act of sourcing, contracting, all of our purchasing, as Shane mentioned, SRM, so community relationship management and supplier relationship management, as well as the analytics that support that department. So within that realm, we are approaching about $3 billion in non-labor spend as an organization, and really want to pivot our focus, especially now with all of the COVID activities, to really understanding how we can best support the communities that we serve. So as you can see on the slide, we are talking today about really our ability at Intermountain Healthcare to impact the social determinants of health. And Intermountain has made a commitment to really focus on the non-medical related factors like housing, for example, that certainly are impacts of that overall health of the community. So we've been modifying our supply chain goals to align to this organizational important element that we're really all tracking down. And that's part of the reason we had this combined event today. So throughout the discussion today, you're going to hear not just from me from a supply chain perspective, but also through leadership from community health, from food and nutrition, and from impact investing, and how we're working collaboratively across our departments to really make sure that we're best addressing the community need as much as we can. If we can go ahead and jump to the next slide. So in particular, this is where we want to focus on our food suppliers and caterers. So especially now with all that's going on with the COVID response, we know the communities are really struggling at this point. So we really are sort of doubling down on this goal right now. And our goal collaboratively is to engage those local, diverse, and sustainable or at-risk suppliers through overall supplier development, local purchasing, or impact investment opportunities. So what do we mean when we say engage? What does that mean? To us, that is to gather more information from you so that we can really make sure that we're understanding best how to work with you, what services you offer, as well as for you to better understand our processes and what we're focused on. Determine which suppliers out there may have opportunities or have products and services that would help meet the needs that we have as an organization. And then understand those who meet those criteria and invite them to attend at maybe a products committee, for example. So helping you understand the process by which we are welcoming local and diverse suppliers so that you're more effective and better educated about how to navigate that process and therefore more successful. And last but certainly not least, the end goal of that really is to identify other successful caterers, for example, that could be part of a preferred list of local or diverse suppliers in a given community or region for anyone at Intermountain to use when they are hosting an event or for any other distribution of food type activities that we have going on, which is why we have Robin and team here today as well. So this is especially important as we, like I said, are reacting to the COVID realities, and we know that that's certainly impacting you guys as a community, which is why we thought this was really well timed. So I just want to reassure you right now, at the end of this presentation, we hope that you will let us know about what your capabilities are. So we're going to talk a little bit about how that works and give you an opportunity to ask some questions, but certainly want as an outcome of this conversation today to hear from many of you so that we know that you're out there and what you offer so we can engage you as it makes sense when we have opportunity and need. So without any further delay, I want to introduce my colleague, Lisa Nichols. She is the AVP over Community Health, and she's going to talk a little bit more about the social determinants of health and the reality of those, especially given the lens of COVID right now.
Thank you, Allison. Good morning, everyone. As Allison said, I'm the Assistant Vice President of Community Health, and I'd really like to spend a few minutes sharing with you why this work is so important to us. So if we could go to the next slide.
Lisa, you're on mute, sweetheart.
Oh.
Give it 30, 20 seconds. Allison, you ready?
Hello? Can you hear me now? No?
I can hear you.
Oh, good. Thank you so much. I'm sorry. I turned the mute off and it would come back on. Allison, thank you for the introduction. I'm Lisa. I'm the AVP of Community Health. And I'd really like to spend a few minutes just sharing with you why this work is so important to us. As a large system, we try to influence the health of the communities in which we have facilities and in which we live. So at Intermountain Healthcare, our mission is helping people live the healthiest lives possible. And a huge part of that is providing healthcare, right? And we have healthcare facilities across the state. But if you look at this diagram, you can see that the outcomes of health, how healthy people are in our communities, only 20% of that is related to the healthcare we provide. So it's really important to us to have a bigger perspective. You can see that health behaviors influence health, the physical environment in which we live, and the socioeconomic factors, things like education and job status and having stable housing and stable income and plenty of food in the house. So if we want to fulfill our mission of helping people live the healthiest lives possible, we've really got to focus in on some of these socioeconomic factors as well. And that has always been important. It's particularly important now during this time of COVID when we see so many people being disrupted as relates to these socioeconomic factors, people losing income, housing at risk, challenges getting food. So we want to collaborate with you really to ensure we're addressing these socioeconomic factors by creating economic opportunity in our communities. So let me say a little bit more, looks like the next slide is coming in, around what we mean by social determinants of health and how they influence health. So this is a diagram that looks at primary and secondary social determinants of health. So you can see things like interpersonal violence, food insecurity, utility needs, housing instability, and transportation are all really foundational to a person's health. And you can see over here on the right side of the screen, a Maslow's hierarchy. So this is really talking about, physiological needs and safety needs have to be met for someone if, we really want to influence health. And again, we really see the opportunity to work with all of you, to be able to create meet some foundational needs for individuals. One of the things we know right now, we're really saddened by, there have always been disparities in our community. We know that there are people who are differentially affected by COVID. People who were previously financially insecure are going to be more financially insecure. And so as we collaborate with you, we really want to be able to the extent we can, focus on those individuals who are most vulnerable. Peggy, if you could go to the next slide, please. So you can see, you see this in the local news, you see it in the national news. Utahns of color 4 more likely to be sick, hospitalized from coronavirus than white residents. That's really related to disparities we see. For example, sometimes it's, just more density in housing. So, our intent again today is to partner with those of you who are local.
Hello, did Lisa finish? It looks like her frame is frozen. Okay, so I'll go ahead and jump in here. Hello, my name is Robin Offenkamp. I'm the Executive Operations Director for Nutrition Services. And here at Intermountain, as Lisa has very nicely described, it's about helping people live the healthiest lives possible. So our department, Nutrition Services, we provide meals, snacks, and beverages for patients, caregivers, our visitors, and even people in the community. It's about 10 million meals per year that we're producing and providing for all of those people I just mentioned. So it's very important to us that we offer healthy foods, high-quality nutrition, and an exceptional experience for our patients and consumers as we're putting our meals together and looking for products. I think there's this reputation out there for hospital food that we all know about, and over the past few years we've been focusing on turning that around. Hospital food will not look like it normally does, or what we've known in the past. So where we want to go in the future at Intermountain Healthcare is to have that high quality, fresh, local, minimally processed, from scratch products that we can offer to our consumers and patients. part of that is done through products committee, where we've had local suppliers and vendors come in and present their items, whether that's an ingredient or a finished product, for consideration to be brought into the system. And we have executive chefs and directors who make those evaluations along with dietitians as we're bringing products in. And I know Peggy and Shane are going to talk more about what that process looks like for coming in. As far as specific products, one of the things that we're also looking at is the sustainability of that product and how it's packaged. So when we're evaluating products, yes, we look at nutrient content, we look at pricing, we look at the uniqueness of the product and how it will be utilized within our services, but also from a sustainable perspective, the packaging that it's in, and the waste that would come from that. So anytime a product can be packaged in a more sustainable way, we're going to be more apt to consider that. And of course, local is important to us in supporting local businesses. We also know that our clientele, they're becoming far more food savvy. So things that we're looking for, diverse, ethnic, unique foods, interesting foods, fusion is big now. In the past, we've seen restaurant industries go in all kinds of different and interesting ways, and healthcare has not really jumped into that. And that's what we're going to be changing as well as we look at new products. We want healthcare and hospital food to be like restaurant industry. It's the same experience that we're wanting to provide for our patients, which is exceptional. And so that can also play a community impact in supporting those vendors and suppliers who can produce those types of things. Also, along the lines of community impact, the catering is going to be very important for us. We do have nutrition services catering within Intermountain, but there are times when we're not able to meet those needs, whether it's just the quantity of it or the demand. So we'll look for those caterers who can bring in that unique, interesting flavor and ethnic foods to offer to caregivers here for meetings and events, and also to support in the community. I'm not sure if there's a next slide there. Yes, the catering. So I think I spoke mostly of that. Last minute lunches were another item that I didn't mention previously that is very helpful when looking for catering partners. And then, as Allison mentioned, there'll be time to talk about how to submit your information for consideration at the end of this program.
Hi, everybody. I can jump in here. Can you hear me okay? Okay, great. Thank you, Allison and Shane and Peggy for having me. My name is Nick Fritz. I'm the Impact Investing Director here at Intermountain Healthcare. I'd like to spend just a few minutes talking about our impact investing work. This is really closely related to some of the things that Lisa was talking about, and is one of our efforts to address social determinants of health in the communities in which we live and work. I've been on board at Intermountain actually is about as long as Allison has, about 10 months. And the impact investing work is really that old. So my role is to help sort of build this program and put it together in a way that really addresses the needs of the communities that we serve. Let's go ahead and go to the next slide. So I'd like to give just a very high level understanding of what the impact investing work is, and then talk a little bit about what we all could use from you to design a program, that may be useful to you. So as I said, this work is pretty new. These are kind of the three, high level maybe traits of the impact investing work, if you will. So the first thing to know is that the impact investing work is intended to address the social determinants of health. So Lisa talked a lot about that. But the idea is that, as a system, and specifically with this impact investing work, we're thinking about ways that Intermountain can move upstream of some poor health outcomes and really start to address some of the root causes of poor health. So we, so far in our impact investing work, in terms of our dollars deployed, have focused a lot on housing and some housing adjacent services. But we really see, you may have noticed one of those social determinants of health that Lisa showed is income and employment. So, given the enormous number percentage-wise of Utahns that are employed by a small business, we would love to find a way to support the small business community with our impact investing work. Part of the challenge here for us is, as I said, the impact investing work is brand new. And we're new to this, right? We're a health system, not a bank. So we're kind of figuring out, what we can offer that's different from what traditional financial institutions can offer, and kind of where our products can fit in the mix here. So the other two kind of priorities that we think about, one is that loans are kind of the primary tool that we've developed so far. So the impact investing work is an additional tool on top of the grants that Intermountain already does. And this pool of funds actually lives in the Treasury Department. So we do see these as investments. So loans are kind of the primary tool that we've developed so far. And we measure the return on those both in terms of a financial return and also a social impact return. So specifically thinking about small business, the first kind of social impact metric that comes to mind is jobs, which is obviously a critical one. So, we'll be thinking about, as we kind of design our small business program, what kind of metrics are we interested in, and not only maybe counting jobs, but thinking about, are there other social benefits that we can measure as a part of this work. And some of the questions we have for you all will help us get there. So following this presentation, we're going to send out a survey that has questions like this. It won't be exactly these, but questions that will help us get at how we can put a program together that's useful. So thinking about, is a loan even useful for your business? What sort of thing would you use it for? What kind of goals would it help you to accomplish? What's the right kind of scale of funds, right? Something we have to figure out internally is, should we be setting ourselves up to make $5,000 loans? Is that kind of most useful and the thing that isn't otherwise available to you? Or should we be setting ourselves up to make much bigger loans? And then, another thing we want to hit head on is there's a lot of, obviously, coronavirus relief resources out there through PPP and also through some of the great work that cities and that the governor's office is doing. Curious to get your perspective on what the gaps are there. I have heard some feedback personally that, maybe the PPP could be a little more flexible and not just kind of work for payroll. And I know that the state and local resources are largely spent or kind of getting there anyway. So I'd love to identify kind of, are there gaps in that coronavirus relief effort that we can fill in, or what role can we play there? So I'll stop there, but big takeaways are, we're building this impact investing program. We'd love to find ways to support small businesses, particularly those who are in or could potentially be in our supplier network. And we'd just love some input from you all in thinking about what would be useful. So I'm going to turn it back over to Allison Corey here to go into some Q&A and to provide a bit of a summary. Thank you all.
Hi, thanks. Really helpful information that we've heard today. So I want to take a minute before we jump into what does success look like and reiterate the Q&A opportunity that we have. At the bottom of your screen, if you hover over it, you should see a Q&A, and they look like chat windows. I think earlier I mentioned a chat box, and actually the correct terminology is the Q&A at the bottom. So I'll give you the heads up that we're going to start to take Q&A after we get through the summary. So let this serve as your opportunity to make sure that you know how to do those. So when this is all put together, obviously the intent really is to make local food and local diverse supplier have success in navigating this. So we have a couple of examples here that really are some shining very recent examples of where we've had local suppliers that have been able to partner with us in new or different ways to make sure that we are getting the food services that we need for our patients and caregivers. And at the same time, we are supporting local business. So you can see Gourmandays is listed there. They in particular have been able to help us in sourcing a number of meals for caregivers and box lunches, as well as this is a great example of where we paid for some of the products, and they actually helped us by donating the desserts and beverages. So it was a really nice collaboration in the way to help provide additional meals for our caregivers. Elizabeth's Catering has done some wonderful work around providing some donated lunches and meals, in particular looking at the downturn from COVID and what would have been surplus or wasted food, and making sure that they were leveraging those for local or for us at Intermountain, rather, for our caregivers that are really on the front lines right now as it relates to COVID. We've got Kumbaya Kitchen, who helped us with some snacks, box lunches, from Schmidt's Pastry Cottage. And then also we have V Chocolates, who is another local supplier that we are having the ability to sell their products in our retail facilities like gift shops. So there's a number of different ways here through box lunches, donations, snacks, surplus food, and then also retail opportunities where we have these local suppliers, frankly, in our facilities and have the opportunity to really show how we are helping the local community by using these individual providers. So as we move to key takeaways, I like to ask my team, what's the so what? So what does all this mean when we look at it together? So just to sort of recap and thread this together, knowing we had a couple of technology hiccups. First and foremost, we have supply chain goals that really align with our community health goals, as well as our Anchor Health Network, and those are to support local and diverse suppliers when we can. And when that makes sense for us as an organization. So that's the supply chain element. Secondly, we have these social determinants of health that Lisa was talking about and how those impact our community as a whole. How we address those is really what Robin was talking about and what we're chatting about today. We are establishing a preferred listing of food and local diverse suppliers. So I want to make sure that that's clear. That's not something historically that we've had pre-organized, but we hope to have that preferred listing by region so that we are making sure when people have meetings or have opportunities for food service that we're directing them to our local and diverse suppliers in the appropriate community. From a food provider perspective, we continue to look for people that have unique opportunities. I think Robin mentioned interesting packaging, cuisine, healthy, things that are sustainable. Those are all really important as we look at those. And so it's important that we understand that that's one of our goals and elements as well, and that we're actively seeking food suppliers and caterers right now. So all of those things in combination with what Nicholas was talking to us about us as Intermountain Healthcare trying to provide closure for some financial gaps that may exist where there's an opportunity for us to invest in a business so that they're more successful in frankly providing those services to us. So all of that being said, why now? the time is really important to us right now, especially given all that's going on with COVID, the risk to the community for these smaller businesses, and an acknowledgement that now was the right time for us to really kick off this process and make sure that we were communicating openly to you guys as our community group about the opportunities. So I want to make sure that folks understand we are, as Nicholas said, looking for opportunities to place that investment funding. So make sure that you're letting us know if there's opportunities for that that you're seeking in that space, and a reiteration that at the end of this, there's a form that we're going to show you how to navigate to on the internet, where you can register and fill out the form and let us know what are the unique food needs or food opportunities that you have that you think Intermountain needs to be aware of, so that we can include you in our future processes. So we will show you that form on the next slide. So if you go to intermountainhealthcare.org, you can navigate to our supply chain organizations, and there's a page really for our suppliers under Supplier Day, and you can see the arrow there highlighting how to navigate toward that. Once you get there, that's where you can find the form with all of the information that we're requesting, so that frankly we're making sure that we have a registry list of all of the individual suppliers that are interested in participating, so that we can make sure and source from that list as it makes sense for us as an organization. So at this point, we will start to open up the discussion for Q&A. So below, again, you can see the Q&A feature, and we will just start to open this up. Peggy has handed me some questions here, so it looks like we already have a question up and ready. Should we apply again if we have presented and not heard results or decisions? I'm not sure if this is a question about impact investing or a food provider, or meaning that we haven't heard back from the committee. I'm not sure, so I'm going to interpret this that maybe they haven't heard back from the committee yet. I don't think it hurts, so I would go ahead and re-register just to make sure. Again, part of this is us making sure that we're organized and collaborating across our departments, and so we're doing a better job of doing that. And I'm sorry to hear that maybe you were left lingering without closure or some sort of notification, but at a minimum, if you go and register again, we can make sure and get you a status update as to why those decisions either haven't been made yet or when they will be made. All right, I'm trying to multitask here. So food provider committee, great, perfect. We answered that perfectly from a guest perspective. The second question we're getting, Lavanya. Hi, where should we apply to be a food provider? So I think this is what we're displaying right here with Saffron Valley Restaurants. Thank you for reaching out and asking this question. If you go to intermountainhealthcare.org and go to this supplier page, that is the appropriate form where you can register and get all of the information logged in one area, so that we can frankly then make sure that we're getting a response to you and considering your food options as it makes sense. What other questions do we have? And they can't all be for other people. I mean, I don't need to be the only one answering questions. Just kidding, guys. Hopefully Nick and Shane and Robin all have to answer questions too. Okay, the deadline and time frame to be on the preferred catering list, and when will we know? Robin, is that something that you would like to speak to?
At this time, we don't have a deadline. Shane, I'll ask you if you have a timeline that you're working on for a preferred catering list.
So Robin, were you able to answer that? I'm sorry, we had a little bit of speaker issue here, and I want to make sure you had an opportunity.
Can you hear me?
Okay, great. We do have a clarification question that came in from Luis. If I sell ingredients to you, for example, flour, avocados, does that need to be made in Utah, or can it be an imported product? Robin, can you take that?
I think to be a local, considered local, within 150 miles of Utah. And those types of ingredients, one of the things that we would ask is that you partner with USDA as a distributor. So reaching out to them and building that partnership is also going to be important just for the distribution across our facilities.
Great. Thank you for that. I appreciate it. We have another question from Jason. Do you offer input to caterers for potential suppliers that they can use who have applied to be an IHC supplier? I'm not sure. Let's see. I'm not sure if the question is if we already have a supplier list. We're actually in the process of pulling that together. The form that you saw this slide is pointing folks to, that form will be open at least through May 15th. And that way we will take all of the results that we've gotten at that point and really stand up our first preferred supplier list. So I think that addresses what the question is there. We have a question for you, Robin. Is IHC looking for vendors who are providing packaged meal kits?
At this time, no. We are creating our own meal kits for caregivers and the community. Thank you.
Okay. You guys are really coming with the questions. Thank you so much. That makes it more fun and more interactive. So I really appreciate that. How many meals on average at one order would be anywhere from 2? So I think this is a question about quantity. So how many meals would be ordered at once if we were to put in meal orders, for example? So in general, I'll defer to Robin, but I know for some of the events that we've sourced, it really widely varies in size, depending on the size of the event that we're hosting. Some of them could be, in the tens, and some of them would be significantly larger. But knowing that I don't have the only group here that is sourcing the catering, I'll let Robin chime in as well.
Yeah, I would say that's an excellent answer, Allison. It all depends on what the event is. We have events that are lunches, small committee meetings, anywhere from 10 to 20 people, and then we have events as large as several hundred people, and it varies.
So there's a clarification to that, Robin, that I'm going to direct right back to you. If we were selected, how often would we be supplying a particular or IHC if they were approved for such a meal? So are these recurring, I think is what the question is, or are they each done as one and done?
I think once you're on the list, it would be a reoccurring thing, not necessarily scheduled reoccurrence, but if you were called upon to do a catering and it went really well and we received good feedback, then the likelihood of being called back again to repeat that business would be pretty secure.
That's great. I think one thing that is important to remember is that just like with all of our suppliers for non-food even, it's very unlikely that a single supplier would meet all of our food needs or all of our supply needs. And so we are doing this with the approach and understanding that frankly we have to piece together almost like a mosaic, a grouping that is unique to an individual event. But if we have a short list or a preferred list, if you will, of caterers and food suppliers that we can work with, that certainly expedites the process for us and increases the likelihood that you would be called again. All right, I hope there's more questions. Here we go. So Nick, we have a question for you. The question is, can you explain more about investment and how do I understand more or get registered for being considered for investment?
Yeah, thank you. Good question. So we use the term investment really broadly. We really see these likely as loans. What we're trying to figure out is what the specifics of that loan program is, right? Thinking about not only what dollar amount is useful, but what kind of repayment terms are useful. And also, if there are kind of what those would be useful for, right? Like, is there a need for financing to help, businesses scale up or to otherwise kind of improve or change operations? Or is the acute need right now kind of these gaps in coronavirus relief that are maybe less about, scaling up or product expansion and more about survival at this point. So that's really all of the context that we have on what the impact investing loans could look like. I will say that there's when we have the survey, and the last question on the survey allows you to enter your contact information if you'd just like to be contacted about impact investing as we build this. I would say that's really the best place to put your information in. And the idea is that once we get some feedback and we can put a program together that is meeting the needs of small businesses and particularly potential local suppliers, we will have an application form. We just don't have that yet. So also putting your email there is just a good way to get that application form in your inbox when we do develop it.
Great, thank you, Nicholas. Really appreciate that. We got a question here from Caputo's Market and Deli. So Robin, this one will be for you. Would we be able to provide larger meals that are broken up by Intermountain Healthcare, or is it better for us to have things packaged as single servings? We are happy to do either. Do you want to speak to sort of the pros and cons of that a little bit, Robin?
Yeah, absolutely. Thank you. It's a good question. At this time, with the COVID crisis going on, we're asking that all meals be individually packaged and kind of contained. There's no self-service allowed through the public health order. But moving forward, once those control measures have been relaxed a little bit, then we would be able to do more of a buffet-style catering, hopefully. When this is all said and done with COVID and we're past it, those buffet-style caterings will be allowed again. But for the unforeseeable future, individually packaged meals are the only thing that we can be accepting.
And so I'm safe to infer from that we would expect them to bring those to us in single serve, not something we would repackage in any of our kitchens, correct?
Correct.
Okay, I think that should address it. Thank you so much. Robin, we've received another question for you. Is US Foods your only distributor option?
It is our largest distributor option, and then we also partner with Mere Copper Canyons for our produce, Wasatch Meats for our meat, and Medigold for our dairy. But there are other ways. If the organization, if the business is not large enough to maybe complete the compliance and all the paperwork and insurance needs that comes with partnering with US Foods, there are still other ways of distributing products throughout our system, as Allison knows, keenly through supply chain.
Absolutely. Thank you.
Allison, could I just provide, just in addition to what Robin mentioned there, part of our goal for 2020 is to provide supplier development opportunities as well. So if you're having a difficult time working with a large distributor, please reach out through that form. Share that in the form, and we can work with you to hopefully start developing that relationship with a large distributor or one of our distributors. If it's a product that's a good fit for Intermountain as well. So I just wanted to add that.
Great, thank you. We've actually received a few more questions, so I'll go ahead and read those for the group so we can get some answers out. What if I have several ways to sell to Intermountain Healthcare? How will that work? I am a local candy maker, and I can do food services and gifting and selling in hospital gift shops. What exactly do I apply for? Robin, do you want to take that one?
Yeah, thank you. So as mentioned and viewed on the screen here, there's the form to fill out for Supplier Day to get kind of registered with Intermountain Healthcare and the supply chain organization. And then our products committee works with Shane and Allison to determine who comes into products committee. We set that up. It's a monthly meeting where local businesses can come in and do presentations, tastings, talk about the products and what the capabilities are and quantity to be able to supply to Intermountain the different routes. And then that products committee works again with Shane to figure out how to incorporate that either into the gift shops or into our cafes or into the products that we're creating.
Great, thank you. This next question from Abby, we're going to have a two-prong approach, so I'll take some of it, Robin, and then I'll give the second part to you. So there's a clarification, I think, about the preferred supplier list. So they're asking, is it a catering service that is required on different occasions and basically will be outsourced to us based on previous events and feedback we had together? I would clarify that as we're standing up this preferred supplier list, it's not just for catering, but there is a lot of catering that it is tied to. So there's also gift shop opportunities and individual food distribution opportunities that Robin mentioned through our different distributors, or if the distribution itself is the problem, you can reach out to us directly and we can do our best to work or direct you to the right groups that could help with the distribution. And then, like all supplier relationships, we definitely are taking feedback from the folks that are hosting those events to understand how it went. Was the food good? You know, are there positive experiences, things we need to work on differently for the next time? So there's always a feedback loop, but I don't think that solely determines the ability to have the initial opportunity, nor the opportunity to try again if we did have some hiccups. So Robin, I'm gonna point the second half of this to you. How many Intermountain facilities around the Valley might be ordering at a given time?
Around the Valley, I'm going to assume that's the Salt Lake City area. So we have I just want to say, Primary Children's, LD Hospital, IMC, our local Select Health, our Employee Services Center, South Office Tower. I mean, there's probably almost a dozen, not even including clinics that might be ordering meals for their staff or events that they're sponsoring. So a pretty fair number. And then if you look outside the Valley, down in Utah Valley and up in Ogden area, all of the hospital functions that are going on there also have the opportunity to order. And just a point that you made, Allison, on the first part of this question, there is the catering aspect, but we're always looking for unique ingredients. I'll just give an example of, say you are a honey vendor, you supply honey, it's Intermountain's looking for Utah honeys that could be used. You could have that sold in the gift shop, you could have that sold in the cafe, or what we would love to see is have that utilized within our recipes. So when we're creating different items, whether that's breads or desserts or something that's unique and special for our patients, to give them an exceptional experience, that we could say, and this is an ingredient that's found in this offering that we're providing. So it doesn't have to be a catering, it could be a unique product that's local here to Utah.
Great, good clarification. I do think it's important. I know this question was specifically directed at the Valley, but our preferred supplier lists, our intent is for that to represent the entire Intermountain footprint, which is the entire state of Utah. So we may have regional options that are able to service the metro, but we may have a different list, or will have a different list, frankly, for St. George and other areas, and including Southern Idaho. So the intent really is to make sure that we understand your ability from a coverage area as well. on, you know, the geography that you would be able to serve with your location or locations. Are there any other questions? I guess I'm going to put in a last call for questions. We have about 6 minutes or so left before we need to wrap everything up. I will say that these have been really interesting questions, and I think what we can do as a team is sort of document some of these Q&A if we can get a list from the Zoom tool itself, and make sure that we sort of post some responses to those if these are the you know, hot topics or the things that we need to clarify, if you will. So anything else that my co-presenters would like to add? Now would be your last chance for closing remarks.
Well, I would just like to say from a nutrition services perspective, thank you for, you know, participating and reaching out to us. We're always looking for new and unique products, like I said, to make the experience here better for our patients and caregivers and the consumers we're serving. So I appreciate this opportunity.
Great, thanks, Robin. Nicholas, were you jumping in?
Yeah, I just want to say thanks to everybody on the line and to the chamber for facilitating. This is really great, and we're excited to do the work.
Great. Lisa, anything?
Yeah, just thank you again, and you know that you're really, again, part of our mission to help improve the community across the state.
Great. So from a supply chain perspective, thank you very much. Oh, from a supply chain perspective, thank you very much. I really appreciate the questions that we received. I'm going to hand it over to my colleague Shane Hughes, who is going to wrap us up today. Thank you.
Thank you, Allison.
Thank you.
Thank you all for your time today. We want to make this as timely and meaningful as possible. We know a lot of local and diverse and sustainable companies are hurting at this time. So please fill out the form. And when you do fill out the form, we do want to make the commitment that we will reach out to you. You will hear from someone from Intermountain, and we will try to work with you. If it's a good fit for Intermountain and it's meaningful for you as a local supplier, then we'd love to move forward as quickly as possible so that we can really make that impact in the communities that we serve. Thank you for your time and enjoy the rest of your day.